My life, my mission, it changed because of a murder. A 4-year-old who was shot in the head by his father. As a healthcare provider, I had taken care of many victims of violence before this, but something with this death made me change. And it wasn't just because of the horror and sadness that you might expect of this scene, where I had to deliver CPR while staring into his beautiful blue eyes, and then compose myself with the rest of the medical team to have to care for his father, the one who shot him and turned the gun on himself. I changed because I learned about the circumstances that led up to this event. There were so many red flags. His father was a violent felon, had a history of alcohol abuse, hospitalizations for mental illness, unemployment. He had been abusing his wife, and he shot their son as a way to hurt her the most. The gun, he wasn't supposed to have it, but a friend gave him one without any consequence. So you see, I changed because yes, this father very much let him down, but a lot of people let him down. A lot of systems, a lot of policies, our society, we let that child down. And I wondered when I went home that night and this story was on the news, I wondered if anyone who watched it felt compelled to be changed like me. But the reality is these stories are on our TVs every single day. Assaults, homicides, and people aren't changing. Oftentimes these stories lack the complexities of what lead to these events and without humanizing the victims. But I decided that I would be changed and that I would change the space that I would occupy as a trauma surgeon and as a public health researcher, and I would challenge others to do the same. You may think that violence is not preventable. You may think that this is someone else's problem to solve, that I don't play a role, that you don't play a role, but I would attest that those beliefs have led us here today, where firearms are now the leading cause of death for American children, and one of the leading causes of death and injury for young adults in our country. And we're choosing this. We are choosing to not keep each other, to not keep our children safe. So I'm here to tell you that much of this is preventable, that I have a role, the space that I'm in, healthcare has a role, and so do all of you. But let's talk about the realities of intentional gun violence in our country. Yes, there are other forms of homicide and assault, but over 80% of them are committed with firearms. And for every one of those people that die, there's another 4 to 5 people that survive. That means tens of thousands of your fellow Americans, your neighbors, your family members, they are then living with the scars, emotional and physical, of surviving an act of gun violence. And while mass shooting events dominate our national news and they rightfully shatter our sense of safety, most of its victims, most of my patients, their stories never make the news. They're more often teenagers, young men, disproportionately Black, from both rural and urban communities that share a common thread of disinvestment and disparity. And they're more often living in states that have weak firearm safety laws and little investment in violence prevention, like the state we're in right now, South Carolina. It has the 4th highest firearm homicide rate in the country. Did you know that? The risks and the root causes, they are complex, which is why there's not just one solution, there are many opportunities for intervention. They exist at the individual level, but also within our families, our relationships, our community, our systems, and our policies, and that's where we come in. So let me give you an example. A patient, we'll call him Josh, that I took care of. He was 16 years old when he was shot. He was shot by another teenager. They had been getting in fights at school and in the neighborhood. And the gun that was used, it had passed through many hands after being stolen from a car. There's a lot more to this story, though. Josh lost his father to gun violence. Afterwards, he was exposed to intimate partner violence in the home. He had untreated PTSD. He struggled in school, where he was often labeled as difficult. He lived in a neighborhood with high rates of unemployment, poverty, crime, neglected spaces. But the boy that shot him, he shares a similar story. As a trauma surgeon, you think that I'm on the back end when people like Josh come for their care. You might think that the opportunity was lost. But people like Josh are oftentimes at the highest risk of repeat violence. And even if they don't have many risk factors, they all then have to face the devastating impacts after surviving a violent injury. I wanted to do more for people like Josh than just treat their wounds and then send them back to the place where they were shot without addressing any of the reasons that brought them there to begin with and without helping them navigate life after experiencing violence. But I knew I couldn't do this alone. So I leaned in on the research and the experience and expertise of other individuals in other cities, and then I found passionate members of our community to start our state's first hospital violence intervention program called Turning the Tide, where our patients get not just me, a trauma surgeon, nurses, they get people that are there to help stop cycles of violence and improve the lives of our patients that experience it. For Josh, what that looks like is they're at his bedside in the hospital to provide empathy and support and to ensure that the healthcare system that is meant to care for him does so without judgment and without bias. They're there to help calm his feelings of anger that might otherwise turn into retaliation. And in the weeks and months after that injury, they're making sure that he's getting to his medical appointments, that he gets the mental health care that he's always needed. They make sure he has a tutor in school, is connected to a mentorship program to help learn about healthy relationships and conflict resolution. And they're even helping his mom get a higher paying job. And they're working in the community to improve the circumstances in their neighborhood. So 6 months from Josh's injury, he's not just alive, but his life is changing. And so are others. Since our program started in 2021, we've helped hundreds of victims of violence and their family members. But we're also transforming what healthcare is, because the people that are from the communities impacted should also be on the front lines of creating solutions and providing intervention. But healthcare can do so much more before an injury occurs, like through programs that help reduce the risk of childhood trauma and neglect, by talking to patients and families about safe firearm ownership and storage that can reduce the risk to children, but also adults that might be going through a life crisis or a cognitive decline. They can talk to families and people about intimate partner violence, provide them support, resources, because the presence of a firearm in their home increases their risk of homicide by 500%. And in states with red flag laws, they can identify risk factors for self-harm and violence and report it to the appropriate authorities. Perhaps programs, strategies like these could have made a difference for that 4-year-old and his mom. And we can do so much more outside of the walls of a hospital by working with law enforcement, policy leaders, community groups, to change the systems and the circumstances in our communities that lead to violence, to work upstream from it rather than being reactive. And we can advocate for more investment and more research, because for the last 2 decades, only $63 were reinvested into firearm injury prevention research for every death due to a firearm. That's compared to the thousands of dollars reinvested into research for things like cancer, heart disease. I think we can all agree that preventing the death of that 4-year-old, of any of us, is worth more than $63. So I've talked a little bit about the small role that I play and what healthcare can and should be doing. And these are by no means exhaustive, and they are by no means adequate. We have so much more work that we can do. And you're probably thinking about all of the other obvious sectors that play a role: criminal justice, law enforcement, but they've been carrying the weight an awfully long time. And they have opportunities for improvement, but they should not be expected to do this work alone. So where do you play a role? As you hear the stories of people like that 4-year-old and his mom, of Josh, of the perpetrators that hurt them or took their lives, The stories that you hear on the news every night about victims, about people, I hope you realize that what you do, the systems, the policies that we create, they all touch their lives. Whether you're a parent, an educator, a healthcare provider, a community planner, a coach, a gun owner, a policymaker, you all have more potential than you probably think to reduce the risk for individuals, communities, to help support survivors, and to help keep your guns safely stored and responsibly owned. And I hope all of you are voters, because you have the power to demand that the people that represent us help to keep us safe and depoliticize this issue. I was changed by that 4-year-old and people like Josh, and everyone that I care for and everyone that I see injured on our TV screens every day. And I hope that you can find something to change for, because we all own this problem, but we also own its solutions. Thank you.